I'm Lavinia with Napier Healthcare. Napier Healthcare provides end-to-end solutions for managing administrative and clinical operations in nursing homes and aged care facilities. We're here today at Residential Gardens located in Rooty Hills, New South Wales. Residential Gardens, opened in 1993, is home to over 100 residents. They offer superior hospitality and care to their residents. Let's take a look and see what Napier has to offer. Napier NHS takes care of operational activities such as pre-admission management. These activities include receiving an application, putting that application onto a waiting list, and then taking subsequent steps until that application is processed. Here at Residential Gardens, Fabian is the operational administrator. He takes care of all operational activities, including pre-admissions. Let's go in and meet Fabian and hear what he has to say.
At Residential Gardens, I use the administration dashboard for my day-to-day operations and in my job. I look at the different categories of residents we have, for example, residents and permanent, and also home care. I also look at the operational status of our residents. I also look at how our beds are being used and how efficiently they're being used. I can track resident belongings, the transfers from home care to respite to permanent, transfers from hospital and to appointments, and also their location within the facility. Continuity of care is very important for us at Residential Gardens, and by using the Napier NHS system, it has helped us very much. We can see the tracking of home care to respite to permanent for our residents and the transfer of information all in the one system. At Residential Gardens, we've done a digital transformation from paper-based to digital by the help of this system. This system has helped us by saving time, improved efficiencies, and cost savings as well. Continuous improvement is within the system, and we can see it in all our different areas. For example, quality assurance, in committees, in feedback, in complaints handling, and it helps us to maintain standards and also assist us with accreditation. In my day-to-day activities, I use the NHS dashboard, the admin dashboard, and with that I look at the quality admin indicators. I can also track the activities of our staff, try and work out efficiencies of our staff and see where we're going badly and how we can improve by using the dashboard.
Now that we've seen what NHS has to offer, let's hear it from Marta.
Napier has been a #1 provider. It was hard to choose one, but we choose Napier because we are confident they can deliver in the way we are needed for a specific service like residential garden for the Spanish speaking. Napier has been excellent and provide appropriate, adequate for each different staff and level of staff. But the other part important is AFI, which is one of the main part of the system for the funding. But the funding is based because that is the way we can provide care to the residents, because everything is in place. And it's appropriate, the form that we have, the system that we have is produce that. The records, they are clear, easy to dealing with, recording everything they are needed to be recorded to maintain the appropriate record of the residents. Any provider who coming in place, any requirement from hospitals, doctors or relative. We have a clear records there, and there are appropriate system in place. We are making absolutely confident that we can deliver what the resident requests. If I'm going to see any incidents or any other report, I can see everything is in the program. From any accidents, nutrition, clinical care, physio, any changes in the care and level of care of the resident, we catch up and straight away. In this system, they have everything in place for us to work in without any risk. That's the main thing. So I'm happy in the way they are delivering the program, in the way they support us, and the way they train my staff.
Let's meet Irene, who's in charge of clinical operations at Residential Gardens.
The program itself is beneficial in that it meets the aged care standards in terms of being able to follow the requirements of each of the clinical care standards. From the time of admission, we are able to capture the care needs of each individual person and we're able to undergo the various assessments of their care needs and then develop the care plans, and then from there we're able to determine the various activities that is required for each individual. We're also able to write up any incidences that has affected each individual and able to then do a full assessment from those incidences and then create the strategies that or the care strategies that we're able to identify and follow through on the various care needs that that person may require. The RPM is the vital signs recording system, and we are able to record a person's vital signs through the system that enables us then to be able to determine and evaluate them against previous weeks, months, days, vital signs, and as a result be able to determine as to how that person is at any given time. There's an alert dashboard as well with the vital signs, and this enables us to be alerted in terms of when a person's vital signs are outside of the parameters for that particular person.
Napier Healthcare, powering excellence at healthcare touchpoints.